Hello, I am Lisa. I am a 38-year-old, a 250-pound woman. Also, I am a kinesiology student. And maybe that sounds strange to you, but I got tired of the struggle and I needed to get health information from a legitimate source, so I went back to school. And I wanted to share with you some encouraging things that I have learned about health, and I hope it encourages you, as it has myself, to just participate in exercise more for overall well-being. So the first thing that I learned is exercise is great for bone health. When you're maturing, like when you're going through puberty, it is a great time to be doing load-bearing exercises, which is just like anything where you're putting weight and impact on your bones. Like one of the top ones would be gymnastics, but also like running, soccer, anything that isn't like swimming, bicycling, rowing. Those are like taking weight off the bones. So yeah, weight-bearing exercises help your bones grow bigger and stronger, especially during puberty. After maturity, though, you can no longer grow bones. Your bones continue to deteriorate. So like it is important during puberty to build up that bone mass so that as you age, you have more room for deterioration before you hit the threshold of fracturing or getting osteoporosis, because bones are like lattices or mesh where they're like intertwined inside, and as it deteriorates, it gets thinned out and it can fracture easier, or you can get osteoporosis. So yeah, if you know anyone that's going through like puberty right away, I would encourage them to be building up bone right now. But if you are like me, an adult and far gone from puberty, you can still do load-bearing exercise to help maintain the bones you already have and to reduce the speed of the deterioration, which can also help you maintain healthy bones above the threshold. Okay, next is hormones have a significant effect on body composition and strength. So males, because of testosterone, have a greater ability to grow muscle and to have like aerobic strength as well, because testosterone also helps with like oxygen uptake during aerobic exercises. It also helps that they can grow taller than us, so there's just more room for muscle mass to grow. And women, because they lack testosterone, can't grow lean muscle mass as well. Also, because of estrogen, they grow fat mass more. So as a female, it is normal during puberty to gain fat mass. It is normal during pregnancy to gain fat mass. It is normal during menopause to gain fat mass. So it's not a willpower thing. It's not like you ate too much calories. It's because biologically you're a female, you are going to put on fat mass. But women put on more subcutaneous fat and less relative visceral fat than males. Subcutaneous fat is fat that's just like superficial. It runs like close to the skin, and it's not as big of a health risk as visceral fat, which goes in deeper in the body and sits around the internal organs. That is where the health concern comes in, is if you have too much visceral fat. So actually, males have a higher risk of disease because they have more relative visceral fat than females, even though females hold more overall fat mass. The next thing is, health is not an easy thing to measure with simple tools. Using a scale, weight, BMI does not give you a very good indication of health. As you know, muscle weighs more than fat, so by testing BMI, you don't really know if that's measuring health or not, because you didn't account for what is fat mass, what is muscle mass, what is bone mass. A better easy, simple, at-home tool that you can use for health measurement is the waist to hip ratio. Because, like I said before, visceral fat sits in your waist on your internal organs, and that is a health risk. So if you have a thinner waist, you're gonna be less at risk for disease. Okay, next is obesity is a worldwide problem. It continues to be on the rise worldwide, and in my country, Canada, where I live in particular, the province that I live in, Saskatchewan, is one of the highest provinces that struggles with obesity. There are many factors that lead to obesity, including social economic status, environment, ethnicity, access to resources, and it's not just a willpower thing. If you are thinking of using activity to help increase your health, there was a study done on children that said that focusing on reducing sedentary behavior was more effective in treating obesity than focusing on activity levels. So that I thought was a good insight to help remember to get off screens, get outside, doing like light activity even is a great focus. Lastly, another point is growth is a result of genetics, environment, and hormones. Genetics plays a significant role in health and obesity. In twin studies, they showed that identical twins had very similar body weights and body compositions, even when raised in different households, which is interesting. Hormones also play a significant role in obesity because they affect growth, fullness and hunger cues, fat accumulation, lean muscle mass growth, and basically it's a complex issue, and calories in, calories out is not exactly the full story. So I hope these points kind of help encourage you, like they've encouraged me to continue to just work on trying to be active, because physical activity can help improve health by preventing many things like heart disease, cancer, diabetes, obesity, depression, high blood pressure, osteoporosis, and low self-esteem. So go out there and get active and be happy and healthy.